involved. But still it's new, so it's in a stage of, negotiations.
¿Alguien tiene alguna otra pregunta?
No se entendió. ¿Quién es el que manufactura el medio?
It calls Numedis Inc. Numedes, Numedis Inc.
It's from USA, right?
USA.
Vamos a continuar a la siguiente plática también por Susan Oak, que es evaluación de la córnea con microscopía especular.
Okay, thank you. Talk about the specular microscopy. Okay, come on. All right. Role of specular microscopy is for accurate evaluation of donor cornea before corneal transplantation. It can improve the availability of quality donor material and reduces the number of failed grafts due to inadequate donor tissue with unsuspected endothelial abnormalities, which likely to miss with the normal, regular slit lamp examination. Also evaluate quality of pre-cut tissue for DSEC and DMAC to get the ultimate outcome for successful results. Why endothelium is so important? Successful keratoplasty is depending on the viability of donor corneal endothelium. Cornea is like sponge, so if you place in the fluid, it swells. The endothelial barrier is leaky, which osmotically draws the fluid with the nutrients from the aqueous humor into stroma. However, unless fluid is pumped out from the stroma, cornea swells. So, the two most important physiological endothelial functions are maintaining effective fluid barrier and also metabolic mechanism for dehydration to maintain optimum thickness and then optimal transparency. Normally, there is a balance between pump and a barrier to keep stromal hydration at the 78% water to maintain normal corneal thickness of about 500 to 530 microns. If this function fails, then cornea will start to swell and then also lose the clarity. This is known as a bullous keratopathy. That's why endothelium is very important. How can endothelial cells get damaged or lost? Through traumatic injuries or long-term contact lens wear, any type of ocular surgery, intraocular lenses, or maybe effect of topical medications, or simply through natural aging, or inadequate preservation of cornea, or mechanically poor preparation of tissue or pre-cut tissue. It was generally known that if endothelium is damaged or lost, then neighboring cell will expand and then fill the potential gap. But we now know by the aid of specular microscopy that cornea can migrate, expand, or coalesce, or in certain occasions, that cornea also mitose, even the incidents are very rare. However, enough cells are lost or damaged, then loss of endothelial function occurs. What are the four most important parameters to assess cornea? Number one is cell density, number of cells per square millimeter, and then cell size variation known as polymegatism, and then cell shape variations known as a pleomorphism, and then, of course, corneal thickness measured by pachymetry. The assessing endothelial reserve There are several factors may be important. For example, donor age alone is not an adequate indicator of normal cell density. In human, when you're born, you have a 3,000 to 4,000 cells per square millimeter. And then also, there is a natural aging cell loss of about 0.5% per year. So if endothelial cells are lost at the rate of normal cell loss, the cornea can live up to 200 years with enough reserve left. Therefore, donor age alone is not the adequate indicator. Also, clear cornea with the normal corneal thickness, in this case 525 micron, cannot rule out the low cell density, in this case only 868 cells per square millimeter, and then also high polymagnetism index of 54, and then very low hexagonality. Also, cell density alone cannot determine corneal stability. Here in this case, both cornea having 2,500 cells per square millimeter, but in this on the left-hand side, very ideal, beautiful cornea has a very low size variations index of 10, and then also hexagonality of 100%. While this side, then high variation, cell size variation of 79, and then hexagonality is only 28.5%. There is enough evidence to show that the endothelium with the high polymagnetism and then pleomorphism vulnerable to the surgical trauma, probably due to the low functional reserve. How to improve accuracy of cell counting? The more the regulatory becomes, requirement of regulatory becomes very stringent, then accuracy of cell counting becomes very important. The image quality is crucial to accurate cell count, and also cornea should be warm to the room temperature, at least 24 to 26 degrees centigrade, to minimize the image quality and then cell visualization. And then also adequate magnification is needed to either trace around or mark the cells. Ideally, multiple sample areas with the statistically adequate cell numbers, at least 50 to 150 cells should be counted. And then cornea should be placed in a good container with optically clear material. Better media, better preservation, better image. They also accurate tracing of cell borders to obtain accurate area for the cell density calculation. Even if it is difficult to determine the borders to trace around the cells, the human eye can resolve the sort of outline of a cell much fairly well. So thus, the center method comes in as a very useful and accurate method to do cell density. The fully automated analysis is very quick, but it's not accurate enough. In order to get the good result, you need a better and reliable instrument. So considering all these concerns in mind, Conan came out with the new specular microscope. The features include low and then high magnifications, ultra-wide viewing area, exclusive multi-sample selections that you can capture up to 4 images in a central cornea. Real-time display of media temperature is very useful to make sure that the cornea reach to the adequate room temperature. The long lifetime LED illumination means low maintenance, and also built-in tachymeter to measure corneal thickness. And then new software with easy-to-use data analysis tools and an integrated database. This is how it looks like. On the left-hand side is the specular microscope, and then on the right is the combination of monitor and then computer together, all in one. Now, In order to evaluate the cornea, as I said before, cornea has to be warm to the room temperature. This is 20 minutes after taken out from refrigerator. Notice that the borderline is not that clear. However, one can put the dot in the center of each cell using center method, and then resulting the cell density of 2,824. Now, this is exactly same cornea 2 hours later. Now you can see the image became much clearer and more cells can be counted, but resulting cell density of 2,890, almost identical to the previous slide, but if you're going to show it to surgeon, better to wait for a while to get the clearer image. Now, no matter how the method is accurate, if operator is not performing correctly, then result cannot be reliable. So, operator needs to be sufficiently trained to perform cell analysis. Then also the area of analysis contains only visible and then recognizable cells. This is very important. And at least 50 to 150 cells should be counted to be accurate. Now, no matter what method you use, the equation to calculate cell density is number of cells counted or analyzed divided by the area inclusive of that cells. So, you don't want to include like a guttata larger than a cell or anything folds or anything it's not visible cells should not be included into the cell count. Now, just to review the role of specular microscopy, the specular microscope can rule out undesirable donor